A troubling trend in the U.S. shows that some racialized communities are at higher risk of death from COVID-19, and there are numbers to back this up. But here in Ontario, the government doesn't collect race-based data, and some experts say that leaves communities particularly vulnerable during this pandemic.
A pandemic only exacerbates what already exists in a society and within a system. And when that system is being taxed, what we end up seeing is that the most marginalized will fall to the bottom. They will fall even further than they already are within that system.
Medical experts like Notisha Massaquoi have long called for the collection of race-based data, what she calls a symptom of biases that exist in Canada's healthcare system. Black populations in particular are having the worst experiences, a lack of access to healthcare, and facing higher rates of illnesses such as HIV, diabetes, and stress-related disorders like heart disease and hypertension. This also leaves the population more at risk to COVID-19 related deaths.
Our situation is taxed, we're in crisis, and those communities are going to be further marginalized than the experiences they're already having within the system. A pandemic only exacerbates what already exists in a society and within a system.
In the U.S., some states have reported extremely high rates of COVID-19 fatalities in racialized communities. Those details made available because of the collection of race-based data. And Massaquoi is calling on Ontario's government to do the same.
What we want to see is that leadership take an extra step to acknowledge the fact that Black communities are marginalized within the healthcare system, that race-based data is extremely important. Without the collection of race-based data for Black communities, it actually accelerates our death rates. And we're seeing that in the States. We want to ensure that we get ahead of that within the Canadian system.
In New York, Hispanics and Blacks together make up 62% of the over 7,800 COVID-related deaths in the state.
They've been hit hard.
In today's White House briefing, officials saying the government is monitoring alarming trends among communities of color, and they're being proactive.
Data collection, targeted outreach to communities of color, and increasing financial, employment, education, housing, social, and health supports so that everybody has an equal chance to be healthy.
Ontario's COVID-19 website provides details on age and gender in confirmed and presumptive cases. And when asked about including race to that list, the province said there's no specific data from WHO or other sectors that address racial risk factors.
Right now, we consider our main risk groups are the elderly, those with other comorbidities, regardless of what race they are, as well as other health conditions that would reduce their immune status. So those are all priorities to us, regardless of race, ethnic, or other backgrounds.
If race-based data isn't being collected, then how do we know where COVID-19 resources are needed? And doesn't that put populations at a disadvantage with not knowing what the risk factors are that put them at higher risks?
Our main concern is if there is spread, and with case contact management, we'll be able to tell which those groups are connected with, so we can do it whether it's in a geographical area.
In the past, the NDP says it was also part of a collective call to ask the Ford government to collect race-based data.
The collection of race-based data right now could actually change the trajectory of Ontario, even as we start to talk about economic recovery. Because if we know who is most impacted, then we have to make sure that our economic recovery plan also takes them into account.
Health officials are reminding everyone that there is no evidence that any particular race or community is at a higher risk of contracting COVID-19, adding that we should all be practicing the same measures we have been in the last couple of weeks of social distancing, staying at home, and of course, washing our hands.